Morning friends. Many of our patients have asked us that what is an ideal sleeping posture. So now this talk today will be based on how to sleep and what is the correct posture in which you want to sleep. Now the whole crux of this matter is you need to keep your body in a neutral position. So when you are sleeping, your neck should be absolutely straight. It should not be bent like this or this because that will cause pain. And if you are sleeping like this, the neck should not be like this and like this. Basically, if you see, because if you see the plumb line, the neck will go like this and this will go like this. So this posture should be maintained when you are sleeping. So if you talk about the sleep, there are three ways in which you can sleep. The most common style in which everybody sleep is a sleeping on the back. So when you are sleeping on the back, you can use a little very thin pillow in which your neck posture is normal. The other thing that you can do is you can use a little bit of a neck support. So this you can use under your neck. So when you are sleeping like this, you can have this kind of support. So you can have a little sort of a round towel beneath your neck and use a small thin pillow. So this is the way when you are sleeping on your back. Now many patients ask us, how should we keep our arms? So if you are keeping your arms like this is a bad posture because this will put a lot of strain on the nerves and vessels which are going here. So you should avoid keeping your head underneath your head when you are sleeping. So this is not a good posture. Now many of the patients are suffering from shoulder pain, shoulder discomfort, and for them it is a good idea to keep a pillow like this and to keep their arm in a supported position. So this will give them a lot of confidence and a lot of relief from the pain they have because of the shoulder problem or shoulder disability. So ideally you should, if you are sleeping on your back, sleep straight. You can use a small neck towel, you can use a small pillow, and if you want you can use a small pillow for a support for your shoulder and for your arm. So this is the correct position if you want to sleep on your back. Now when the question arises about sleeping on the lateral side, you must realize that the ideal size of your pillow is from here to here. So we don't want your neck to be like this or be like this when you are sleeping. So the ideal size is from here to here. So this is the ideal thickness of your pillow. So when you are lying down on your side, if you are sleeping on a single pillow, this may actually make your neck stretch towards one side. So you may want to use two pillows to make this on a neutral position. So if you see like this, now the neck is at a right angle position or a neutral position. Supposedly if you use three pillows, then your neck is in lot of stretch and it may cause pain and discomfort. So again, using a lot of pillows are not recommended and using a single pillow is also not recommended. So use a pillow which is actually exactly this wide. Okay, so this is a very important concept that you must realize. Now the same thing applies. If you have pain in your shoulder, so you should not sleep on the same side. So if you have pain on the right shoulder, you should sleep on the left shoulder, and you can keep a pillow like this to support your arm. So you can use this pillow to support this arm or this shoulder which is painful. So, and again, you should not keep the arm beneath your head. So if you keep it like this or like this will be painful. So avoid keeping your head, keeping your arm, keeping your shoulder and keeping your arm underneath your head. So that is not recommended. So these are the two most common positions that we recommend for all of the patients. But some patients ask that we have a habit of sleeping on our stomach. So we usually recommend that this is not a good posture because when you sleep on the stomach, the problem is your neck is actually extending a lot. So if you are sleeping on your stomach, the neck is actually extending a lot and rotating a lot. So we usually don't recommend sleeping on your abdomen. Supposedly if you want to sleep, what you can do is you can keep a small pillow underneath your chest. So that will give you a better posture and your neck position will be better. And again, as I told you earlier, avoid sleeping in this position. So you should not keep your arm underneath your head. So if you are sleeping on abdomen, by and large try to avoid it. If you cannot avoid it, you can keep a pillow underneath your chest. The other important thing, if you are sleeping in this prone position or sleeping on your abdomen, you should not use a very hard kind of a surface. You should use a soft kind of a cushion or soft kind of a mattress. Then there are some ladies which are pregnant ladies. So in pregnant ladies, what we recommend is sleeping on the left lateral position. So pregnant ladies should sleep on the left side and on the sideways. There are other questions in which people have asked that what kind of mattress should we use. So most commonly we recommend that you should either use a firm or a medium to a firm mattress. Because if you use a soft mattress, the chances of having back pain is high. Because it will curve along to there and your posture is bad when you are sleeping. Usually soft mattresses are comfortable for the body, but they can give rise to orthopedic problems. So you avoid it. Hard mattresses are uncomfortable, so you better to be in a midway. So medium to firm mattresses are good as far as your sleep is concerned. Now pillow, as far as we have discussed, it depends on the type and the position you sleep in. We have tried to cover almost everything pertaining to sleep postures. Still, if you have any more questions, please free to write up in the comment box. We'll be very happy to answer your queries. Thank you.